Today we will be discussing surgical treatment for gingival recession. We have already discussed of classification of gingival recession. So before we discuss surgical treatment of gingival recession, we should be thorough with certain terminology like pedicle graft. So what is pedicle and what is free graft? The concept should be clear. What is pedicle graft? The pedicle soft tissue graft, these type of graft remain attached at their base and involve the positioning of soft tissue over the recession defect. So what will be giving the incision in such a way that the blood supply of the graft will be intact. So it will retain the blood supply and during the transfer to new location. And if the blood supply is retained, so result will be definitely better. So let us see. This is the gingiva and overlying epithelium. If we'll give incision in the gingiva, if we give incision in the gingiva like this, so the blood supply of the graft is still intact. From here, the blood supply of the tissue is still here. And now, if we displace the flap coronally or apically or laterally, the base of the flap, the base of the graft, it is still having its blood supply. So the intact blood supply of the graft is there, and that is why the result will be better, because the graft is having its blood supply. So this is called pedicle graft. Pedicle means the blood supply of the graft is still intact. So this is pre-op, in which we can see the epithelium underlying connective tissue, and this is after giving incision and displacing it slightly coronally. We have displaced the flap coronally, and we can see that the blood supply is still intact in it. So this treatment, when we pedicle flap, when we will be doing for the treatment of recession coverage, so we can see this is a case of lateral displaced flap, in which we have displaced the pedicle flap laterally. And why we are saying pedicle graft? Because the blood supply of the tissues is still there. So result will be definitely better. We'll be discussing in detail. Right now we are focusing only on the definition. What is meaning of pedicle and what is free graft? So it is not completely detached from the donor side. The pedicle, it is not completely detached from the donor side. The part of it is only transferred to the adjacent site. It is contraindicated in narrow oral vestibule. If vestibule is very narrow, it is contraindicated over there. And if thin biotype of gingiva is there. Disadvantages include limitation of single tooth treatment. We can do only this treatment in only limited teeth. If single tooth is there, then only we can go for this pedicle graft. And if minor shallow recession, then only we can do this pedicle graft. Advantages are, since the blood supply is intact, the healing will be fast as compared to free graft, and harmonic color match will be there, just because the tissue is it has displaced from one side to the another side, so color matching will be better as compared to the free gingival graft, and only one surgical site is there. Now coming on to the free graft. In this case, a window is made in the gingiva and underlying connective tissue is removed. So a window is being made on the palate and underlying connective tissue is removed. So we can easily make out, if we have removed a segment of connective tissue, that means the blood supply it's not there. We have removed a piece of connective tissue without the blood supply. That is why we are saying free graft. So the basic difference between pedicle and the free graft is that the blood supplies will not be there in the free graft, but it will be there in the pedicle graft. And in second case, we have removed the epithelium. So this in case in which we have removed epithelium along with the connective tissue, this is known as epithelialized graft because it contains a segment of epithelium. But the main point is that it's a free graft, it does not contain its blood supply. So looking again, this is free connective tissue graft because we have removed only connective tissue, and later on we'll suture the epithelium back to its normal position. We have removed only underlying connective tissues. But in the next case, we have taken both epithelium and underlying connective tissue. That is why this is known as epithelialized graft. So like this, we'll be making a window on the palatal side, and we can either remove epithelialized graft or subepithelial underlying connective tissue graft. The use of pre-gingival graft and subepithelial connective tissue graft in root coverage is indicated for the treatment of single or multiple gingival recession. So we can go for single or multiple gingival recession also. They provide significant reduction in gingival recession depth in Miller class 1 and class 2 gingival recession defect. Subepithelial connective tissue seems to offer root coverage with better color match between the donor and recipient side tissue, rendering better aesthetic as compared to epithelialized graft. In epithelialized graft, the color mismatch might be there, but if we take connective tissue graft, then the color match will be better. Systematic review. If we look at the systematic review is a summary of all the literature on a particular topic that meet predefined eligibility criteria. So if you look at the systematic review of the treatment coverage of gingival recession, the coronally advanced flap plus connective tissue graft give the best clinical result. Now, surgical treatment of gingival recession will be discussing under first pedicle soft tissue graft. Now, this terminology, pedicle, this is clear. The pedicle is a graft that contains its blood supply. So, under this there are rotational flap in which we will be either rotating it laterally, we will be sliding it laterally, or we will be doing double papillae in which we will be moving the papillae from both the sides. But the main important thing is that blood supply will be intact, so better result will be there. Or we can go for advanced flap like coronary advanced flap or semilunar coronary advanced flap. We'll be discussing each of the topic in detail later on. Free soft tissue graft. The first we have discussed pedicle soft tissue graft, then free soft tissue graft. In this, epithelialized graft will be there and subepithelial connective tissue graft. But the free, meaning free means that it is devoid of its blood supply. Other methods are we can cover the gingival recession with GTR or soft tissue substitute like alloderm membrane platelet rich plasma with biologically active protein like amylogenin. In the next topic, we will be discussing each of this treatment modality individually. Thank you.